Gray, a volunteer with Vets Beyond Borders. I'm going to talk about first aid for burns, heat exhaustion and smoke inhalation problems. Burns injuries involve variable tissue trauma. It can be relatively minor up to very serious tissue damage. It usually involves intense pain, reduced blood pressure due to fluid loss. The animal develops a state of shock and develops sepsis, which is an overwhelming infection due to impairment of the immune system. And each of these features need to be taken in hand in treating. Pet first aid treatment for burns involves cold water compresses, try and cool the skin down, apply to the wound area directly. This particularly is important in the first 3 hours post-burn. Protection of the wounds: initially wrap the animal in a towel or blanket. Later, sterile non-adhesive dressings such as sulphadiazine are important to protect that wound area. Pain relief is important. Non-steroidal anti-inflammatory drugs are of some use, but stronger medications are often required, which will be under veterinary supervision. Other treatments will involve veterinary attention, such as IV fluids to restore their fluid circulation, prophylactic antibiotics which are provided to decrease the risk of sepsis developing. Badly burnt areas may require surgical removal, reconstruction as healing progresses. Considering heat exhaustion, basically it's when the body gets overheated. It's what we know as hypothermia, where the core body temperature gets very high. There's excessive panting. The dog will collapse under excessive heat. We treat with cooling again, cold water hosed onto the animal, cold compresses, and then IV fluids and oxygen under veterinary supervision. Smoke can affect pets too. Some signs of smoke problems include lung damage, where the dog has difficulty breathing, anoxia or lack of oxygen, struggling for breath. They tend to go blue in the tongue, what we know as mucous membranes, the membranes inside the mouth. And they also inhale toxins such as carbon monoxide, which can poison the system. Treating for smoke inhalation involves ensuring clear airways and oxygen administration, pain relief, antibiotics, similar to heat stress. Animals most at risk of smoke inhalation and heat exhaustion are short-nosed dogs such as pugs, boxers, bulldogs, and Persian and Himalayan cats. Older animals are more prevalent: immature puppies and kittens, and overweight animals. Recovery from smoke inhalation varies according to age, general health and extent of injuries, generally around 48 hours to many months. When there's smoke, it's best to keep the animals inside if possible, on a cold surface. Tiles is fine. Ensure adequate ventilation, air conditioning is fine, or a fan. A special thank you to long-time VBB supporter, the Animal Referral Hospital, for providing resources for production of this video.